So CME, continuing medical education, is critical, whether we're live or virtual. Medicine changes. What we understand about cancer changes. What we understand about breast cancer changes. And the only way that a doctor can really stay current is through CME. So CME is not less important because we're not live, because we're not virtual. At Maimonides in South Brooklyn, our surgical services had to close over a 6 to 7 week period during the peak of the COVID pandemic. And so what that meant was we had to find a way to treat cancers medically while we waited for surgery to reopen. We were very successful in doing that, actually. And now, as we've seen the number of cases decline sharply, and as we enter some sort of new normal, we're taking care of those patients who were treated medically during the COVID surge, and they really have done well. So this was an enormous paradigm shift in how we treat cancer. I think the biggest challenge for our 6,000 employees at Maimonides Medical Center during the peak of the COVID surge was being brave, was coming to work every day, being safe, but exposing yourself to the risk of contracting what for many has been a deadly virus. So I think the determination, I think the spirit, and frankly the bravery of these healthcare heroes who got out of bed every day and came to work, I think that's the most remarkable part of the COVID pandemic surge. So I think that PER and OncLive played an amazingly important role as we shut live meetings down, as we shut, even locally at our hospital, we shut our live tumor boards down. So on both a micro and a macro level, we had to go virtual. And PER and OncLive immediately jumped into the fray with a large number of webinars, webcasts, educational sessions, panel discussions. I was able to moderate 3 or 4 panels specifically looking at cancer and COVID. And what was interesting about that was how they changed, how our understanding of COVID changed, and how we were able to share that with areas of the country that had not yet experienced a COVID surge. So I think that PER played an extraordinarily important role during COVID. I think that CME companies like PER have done a great job, but I think we're all learning. I think we're understanding better and better what does education look like virtually? What works? What doesn't work? What are the best platforms? What are the best tools that we can use? How do we keep our audience engaged? How do we maintain a dialogue? How do we maintain interest for someone sitting in front of a smartphone or a computer? So I think that companies like PER evolved very quickly during COVID, and I think they continue to evolve. I think PER continues to be central to this, and I think they're doing a great job.